The mental status examination is another tool that we use in the assessment process. And the purpose of the mental status examination is to measure the level of cognitive impairment that someone has. Level of cognitive impairment that someone has. And this is a tool that's used with individuals who are suspected of being under the influence of drugs and alcohol, individuals who are psychotic, so people who are having hallucinations, delusions. It's also used with individuals who have neurocognitive disorders. Dementia is actually the video that I'm going to show you using the mental status examination is with a woman who has a mild degree of impairment due to dementia. So with the mental status examination, what we're trying to do is we're trying to get an assessment of the individual in terms of their presentation and their ability to function, right? So when we take a look at these spheres, the realms that we're looking at, we want to take a look at appearance. Is the person dressed appropriately? Do they have proper hygiene, right? If the person comes in and it looks like they haven't bathed in a while, you know, they've got marks all over their face, that may be an indication of a greater degree or severity of drug and alcohol addiction. Orientation, do they know who they are, where they are, when they are? So do they know what their name is? Do they know what building they're in? Do they know what town they're in? Do they know what the year is? Their behavior, their facial expressions, their body movements. Do they seem overly antsy? Are they jittery? Are they bouncing up and down? Can they not sit still? Their speech, are they talking really fast? Are they talking really soft? Are they talking really loud? Is their voice going up and down? Are they coherent when they talk? Are they slurring, right? All signs of intoxication. Their mood. I want you to know what the word labile means. L-A-B-I-L-E, labile. It's a sudden shift in a person's affect, a sudden shift in a person's emotion. If you've ever spent time around drunk people, you have probably seen mood lability, a labile mood. This is the person who is talking to you and they're happy and they're laughing, and then you say one thing that they interpret the wrong way, and suddenly they're yelling and screaming, like out of nowhere, yelling, screaming, getting angry, and then a minute later they're crying and apologizing and saying, "You're my best friend, I'm sorry I yelled at you," right? That mood lability, that can be indicative of a substance abuse issue. That can be indicative of dementia. It can also be indicative sometimes of some other conditions, including physical conditions. So mood lability, we want to kind of assess that. And then thinking, we'll talk about this a little bit more in a later chapter, but are they having thoughts of suicide? Suicidal ideation, that's SI at the bottom of this slide. HI, homicidal ideation. Delusions and hallucinations. Are they seeing things, hearing things that aren't actually there? Are they thinking things that are happening that aren't actually happening? I'm going to show you a clip of a mental status examination, and what you're going to see, again, they're working with a woman who's in the earlier stages of neurocognitive disorder, and they're going to ask her to do certain things. They're going to ask her certain questions, right? Like what the year is, what floor of the building she's on. They're assessing that orientation. They're going to ask her to remember certain things. They're assessing her memory. They're going to ask her to follow some basic tasks, like taking a piece of paper, folding it, and putting it on the floor. All of this is done to assess her coherence, is to assess her level of cognitive impairment. We wouldn't exactly do a mental status examination with substance abusing clients exactly the way they're doing it in this video, but it's a good illustration overall of the process.